Good morning, everyone watching from all around the world. Welcome to BHIS TV. Now, today in Bayelsa State, we're experiencing a significant and epochal event. We're witnessing the launch of an amazing, and not just amazing, beautiful healthcare initiative which the Bayelsa State government has put in place in partnership with GAVI, the Vaccine Alliance, and UNICEF. The enrollment of 10,000 vulnerable Bayelsans into the Bayelsa Health Insurance Scheme. That's amazing.
This free treatment of the insurance, they help our children, grandchildren, even we adults safe.
If my child is sick, I'll carry him to go to the health center and they can attend him well.
Together, we can build a Bayelsa that is vibrant, resilient, and committed to the well-being of all its citizens.
The national anthem, please. Our wonderful Governor of Bayelsa State, represented by the Secretary to the State Government, Commissioner of Health, our dear Head of Service, may I be stand on every other established protocol. Where the government recognizes healthcare as a social right and not a privilege. This means that the extent of health insurance coverage in the state is a function of the availability of these pooled funds. This is why GAVI, through UNICEF, should be commended for paying health insurance premium for 10,000 vulnerable people from various communities in the state at the rate of 12,000 per life per year, to have access to the basic minimum package of healthcare services in designated primary healthcare centers across all political wards in the state for 1 year.
My name is Dr. Marcus Oluwadare, State Coordinator of Bayelsa State Field Office of WHO. WHO is an organization committed to promoting health and well-being for all. We are also keeping the world safe and serving the vulnerable. We would like to take this opportunity to first and foremost congratulate Bayelsa State government and the good people of Bayelsa State for this laudable activity taking place today, and also emphasize the importance of health insurance for communities in Bayelsa State. Health insurance plays a crucial role in ensuring that individuals have access to the care and treatment they need to stay healthy and to effectively manage any health challenges they may face.
We did a study that was at FMC, and we found out that virtually almost 60% of the people that present to our facility as at that time, they present when we could do nothing. Little did I know that the reason they don't come to these facilities was not because they were primitive, not because they did not care about the health condition of their children and themselves, but it's strictly because they didn't have the funds. Because when the health insurance came on board, we saw these same people that were not coming are now rushing to the health facility. So I want to say a very big thank you to the Bayelsa State government that this insurance that we started, that we are continuing, and we know that at the end of the day, virtually every person who is resident in Bayelsa State will be covered.
every clap is an additional child. Am I right?
Yes.
Yes, he's saying yes.
Thank you. Today's occasion symbolizes a substantial leap forward towards our collective effort to ensure that the most vulnerable among us have access to essential healthcare services which are fundamental to their well-being and development. This initiative will not only provide critical medical care but also bring hope and security to countless families across the state. UNICEF, in collaboration with the Bayelsa State government, healthcare providers, and dedicated partners, has always prioritized the health and welfare of children and women. The health insurance scheme is a testament to our shared commitment to building a world where every child, regardless of their circumstances, can thrive and reach their full potential.
My name is Edliong Edson, and I'm the state team lead for Clinton Health Access Initiative. At CHI, we are committed to supporting this initiative that improves health indices and outcome. Collaboratively, we have supported the state to enroll over 5,000 vulnerable population. We are honored to work alongside partners who share the same vision of health equity and access to all. Your effort resonates deeply with our own, and we believe that together we can achieve significant impact in health and the well-being of the community and the people of Bayelsa State.
Many families. And we wish to also recommend to other corporate bodies operating in the state who will soon go on this campaign to come buy into this. They have been told it's only 12,000 per life. And by doing that, you make an impact on the health of vulnerable people. Thank you very much.
This celebration will be demonstrated with a dance.
Today we are demonstrating and we are celebrating the pulling out of additional 10,000 people out of poverty. And all of us know that health is one commodity that you do not decide when to buy. That is why it is important that the only way to go, not to send people to poverty, is to have a social health insurance scheme working. The Bayelsa Health Insurance Scheme is a model, and it is the best in the Federal Republic of Nigeria. Only Bayelsa Health Insurance Scheme that provides insurance beyond retirement. In this model of emergency medical services, we are going to have a hub. So therefore, if you have an emergency anywhere in Bayelsa, all the ambulances in this state, whether private or government, will be registered with this center. Once you have a problem, just like boats, you send to the center. The center is not going to send ambulance from here. The center will look at the ambulances available to your location where that emergency call is coming from, and get that to get the person to the hospital of his or her choice.
This is the message from the governor of Bayelsa State on this special day. Let me begin by emphasizing that a cardinal objective of my government's prosperity agenda is health care. And as I've often said, healthy people are the foundation of a prosperous state. However, I cannot overemphasize the point that prevention is the cornerstone of sustainable health care. As we work to expand access to quality health care, it is essential that we prioritize preventive measures. Let us place a premium on empowering our citizens to take control of their health through regular exercise and lifestyle choices to avoid many costly medical conditions down the line. I challenge all citizens, especially government officials, to commit to make time in your busy schedules to join the compulsory prosperity walk every Thursday. Make your health a priority and encourage your family, friends, and neighbors to do same. Together, we can build a Bayelsa that is vibrant, resilient, and committed to the well-being of all its citizens. This is not the governor, this is me. I want to create a platform where we can interface with all the clusters. Now, the provisions of this act says you can have 70% for infrastructure, 20% for investments. What is the best investment? Health. So I want to use the platform of my office to interface when this comes on board, because we can conveniently bring another 500,000 persons on board.
To do that is the representative of UNICEF.
Have benefit many things, because anytime if my child is sick, I'll carry him to go to the health center and they can attend him well. So including myself, if I go there, they will attend me. They will take care of me well.
Like when body warriors will come take free treatment, all these things are the benefits of the government only they achieve. Like this free treatment of the insurance, they help our children, grandchildren, even we adults.